Now, if you are a nurse who's thinking about working in a nursing home here in the UK, well, I put together a list of things that will give you a general idea about what to expect when working in a nursing home. In an earlier video, I talked about how nurses are generally being paid more in nursing homes than in the NHS. Now, if you want to check that out, go ahead and click on the iCard right here. For nurses who are working in a nursing home, each time a resident is admitted, nurses are expected to do the assessment on the resident. So we as nurses will have to assess how the resident is mobilizing, how the resident is eating, the swallowing, how the resident is moving around, doing ADLs, if he or she would need assistance. We assess all these things, including things needed when he or she is sleeping, if that resident is continent or not, if that resident would need help turning him or herself in bed, if that resident would need assistance standing up, walking around, eating, washing him or herself, if the resident requires hearing aids in order for him or her to communicate, if the resident requires charging of batteries for his or her neurostimulator, if that resident requires glasses in order for him or her to see, if that person is legally blind, if that person requires a Zimmer frame, a walking stick, a relator, a full body hoist, a standing hoist, all these things we assess. So as nurses, we are expected to look into these things and document that we have done so. Now, if there are risks, we are expected to look into them and identify ways in order to lessen or avoid or decrease these risks. Also, during admission of a new resident, we as nurses are expected to register them to the local GP. This depends on the nursing home, but that's what they generally do. We fill up a form and then we put in the details of the resident and submit this to the local GP, or here in the UK they call them surgery. On admission as well, we as nurses are expected to refer our residents to other healthcare professionals that we think may help them with their condition, whatever it is. If that person has a pressure sore or moisture lesions, we refer them to TVNs, tissue viability nurses. Or if that person has diabetes, we refer them to diabetic nurses or a diabetic team. If that person has mental problems, we refer them to psychiatrists. Or behavioral problems, then we refer them to, I think we call them behavioral nurses. I'm not sure about that, but there is a specific team that we need to refer them to. People with learning disabilities, we refer them to a specific group as well. If our new resident is on palliative care, then we refer them to the palliative team. On the nursing homes that I've worked at, we have this regular medication cycle change. A big part of the responsibility of nurses in nursing home is ensuring that the residents have their medications, the proper medications, the right dose, the right kind. Is it fast acting? Is it modified release? We all have to look into these. So in nursing homes, and I do not know if this applies to all, they have this cycle that they call, and in the nursing homes that I've worked in, their cycles are in 28 days. So each box of medication has, if the resident takes it once a day, then that box would have 28 tablets. Now that would depend entirely on the pharmacy that the nursing home source their medications, because sometimes they are already in a blister pack, so all they have to do is pop them and put them in a pot and give them to the residents. But other pharmacies, they have them on boxes, so each time you have to pop each medication and count them if you have the right number. This can be very tedious, and again, this depends on the nursing home and the pharmacy where they get their medications. It's also your responsibility as a nurse to rectify any errors in the medications that you receive. So you look into these things. If the pharmacy has supplied missing tablets or the wrong kind, then we go back to the pharmacy and ask them for the right kind. Now, what we need to keep in mind is that nursing homes do things differently, and what I'm saying may not apply to the nursing home where you'll be working at or where you're working at. It really depends on your job description as a nurse and your role as a nurse. Another thing to expect when you're working in a nursing home is that you'll be doing a lot of documentation. Back when I was still working in a nursing home, documentation would take up a huge part of my time. I worked a 12-hour shift and documentation would... Nursing homes have lots and lots and lots of documentation that we as nurses need to ensure are completed. Examples of these are turnaround charts or the repositioning charts, the fluid intake or input and output charts, the food charts, the behavior charts for people who are physically or verbally aggressive and we are doing an intervention. Cream charts for people who have dry skin or have problems with skin. Equipment inspection or cleaning chart. We need to ensure that our equipments are being cleaned at a regular basis and that they are being inspected and working properly to avoid accidents and safeguarding issues. Say the suction machines, the hoists, the wheelchair, beds and mattresses, food temperature as well, along with water temperature. We need to document all these so that we have proof if there are problems that may arise and people like the CQC would do investigations. We have all these things that we can show them that we are doing our jobs properly. Now, I don't mean to discourage you or scare you. It's just that for me, back when I was in the Philippines, when I was still a nurse in the Philippines, my documentation would be like this for each patient. Not even a page long, not even a quarter of the paper. I'd be documenting like maybe 6 lines and that's it. Sometimes even 4. For those of you who do not have an extensive experience working with elderly patients, expect to see when you're working as a nurse in a nursing home, dementia, depression, and bedbound patient, because a lot of the people in a nursing home are not able to take care of themselves. It can be because of their dementia or any other problems. They may have depression or may develop depression while they're in the nursing home. They may be bedbound due to physical disabilities. That patient may have had a stroke years before. So it's very common to see residents who have problems swallowing or communicating. So this is when our referral to other healthcare professionals come in, like in this case, the SALT speech and language therapists. Oh, and by the way, I have made another video about terms and abbreviations which you will encounter if you are working in a nursing home, and I have put it right here. If you click on the icon right there. The reason why I'm saying this is that for me, who does not have much experience working with older people, I was a bit nervous working with them, especially with the people who have problems swallowing. I didn't know how much food I could give them or how much drink I could give them. It will take a little getting used to, especially if you are like me, who initially didn't have a lot of experience working with older people. And you would also get residents who would tell you stories about their life during the World War II, and it's just amazing how much detail they can still give you. In addition, working as a nurse in a nursing home, you should also expect to be using devices or equipment which will help you transfer patient from bed to chair, or chair to bed, or wheelchair, or wherever you need that person to be. You will probably be using full body hoists or standing hoists or rollators. What else? Gutter frames, CTAC, GTAC. Of course, there's the slide sheet. So expect you will be taking care of residents who have poor mobility, so you will be using all these to help make your life much easier as a nurse. Also expect that you will be having CQC inspections. Now, CQC is the Care Quality Commission, and they try to do inspections every year for each nursing home in the UK. So you will probably be encountering these people during your stay in a nursing home. What do? Well, they ensure that each healthcare institution provides quality care and are taking care of their patients, their residents, the way that they should, and they evaluate them and they score them, they grade them. So if you already know where you're going, which nursing home you'll be working at, go ahead and go to the CQC website and check. Look up their name and you will see what score they have or what grade they have. As well, working as a nurse in a nursing home here in the UK, expect to hear the word safeguarding, doles, MCA. Now, if you want to know more about these things, go ahead and click on my video on the description below. It takes a while to describe and explain these things, so if you want to know more about them, just go ahead and click on the link below at the description. Now, because of the nature of a nursing home, you will also be getting residents who are disoriented, people who have problems with their mental capacity, people who will be difficult to deal with, basically. Yeah, that's basically what I'm trying to say. They sometimes may be aggressive, and again, this may not be a case in your care home because that depends on the people you're working with, on the management of that care home. While I was working in the nursing home, I've had residents who are restless during the night, who still try to get up even if they no longer can, and would end up falling on the floor and injuring themselves on the head, fracturing their femur. Things like that happen. I have had residents who would try to escape from the home. I've experienced running after a resident who got out of the nursing home. These things can happen. Like I said, again, I would like to point out though that this depends on the management if they will accept these kinds of residents. And again, I'm not trying to scare you. I'm merely stating the things, my experiences working in a nursing home. And I can't stress enough, this might be different in a nursing home where you will be going or where you are working. To be fair, you would still get residents who are still lucid and kind-hearted and really pleasant to work with. So these are the people who you may build relationships with. I guess what I'm trying to say is it's not all dementia, it's not all depression, it's not all running around or aggression. That really depends on the nursing home where you work and the residents that they admit in that nursing home. So it's nice when you actually have residents whom you can still talk to and just share experiences. So when you're in a nursing home, just make sure to spend some time, sit with your residents and talk to them, and they will appreciate that. Because, you know, no one likes to be cooped up in their room the whole day or just sitting around watching TV. It's nice to communicate with these people. Another thing you can expect when working as a nurse in a nursing home is for your managing skills to get better, because they will. When you're a nurse working in a nursing home, you will not just be managing yourself, your time. You also be managing your residents, you'll also be managing your staff, you will also be managing the relatives of your residents. Let's not forget about them. So you as a nurse will definitely develop your managing skills, because you need to balance out all these things when you're working in a nursing home. Because working in a nursing home, you as a nurse would really need to learn to put your foot down. Be bossy in a polite way, because in essence, you will be managing the nursing home if you're the only nurse there, or that floor if that nursing home has multiple floors. You will be the person in charge. You need to remember that. And we also need to point out that your priority is the safety of your residents, the health of your residents. That's why, in my opinion, the more seasoned nurses, the ones who are more confident with their nursing skills and their management skills, will do very well in a nursing home. So that's all we have for today. Now, if you found value in this video, please go ahead and hit like and subscribe, and check out my other videos as well. And once again, this has been Charwin of Pinoy Nurse here in the UK.